No hype, no fear, just honest health conversations. Hi, this is Dr. Manasa Reddy. Today we have a very special guest, Professor and Doctor too, Dr. Tom Cherian, liver transplant surgeon with us. Let's welcome him. Hello, Andy.
Hi,
Truly honored to have you on our
thank
podcast.
you.
So, how are you
Nice to
doing?
be interviewed by another doctor.
Thank you, thank you. How are you?
I'm fine. Things are good.
So, what inspired you to be a liver transplant surgeon? And how about your journey too?
Yeah, as most things in life, it's a combination of serendipity, being in the right place at the right time, and a little bit of chance, isn't it? So, when I was a trainee, I didn't know about anything called liver transplantation. But I was placed in a hospital called Queen Elizabeth Hospital in Birmingham because my training was in the UK. And it so happened that Queen Elizabeth was the biggest or second biggest liver transplant center in Europe at that time. So naturally, when I went there, I saw this. I thought, "Oh wow, this sounds good." And at that time, liver transplantation was very new, and it was supposed to be very difficult, very complex. So for a young surgeon, I was quite, what do you call that, excited by that concept. So that's how the idea started.
Okay.
But also that as I did my training, I first wanted to be a GI surgeon. Then my boss came to me and said, Tom, you cannot be a GI surgeon anymore. You got to decide, do you want to be a liver surgeon or a intestinal surgeon?
Because you were doing it in UK.
In the
It's not
UK,
in India.
yeah, and its specialization had started.
True.
So I said, oh, intestinal surgery sounds a little old. So I'll go to liver, and that's how.
Okay. So let's dive into the topic. Um, as a liver transplant surgeon, what do you mean by fatty liver?
It is just the accumulation of fat within liver cells. Now, a small amount, let's say 2% or 3%, is acceptable and what would be considered normal. But when it goes beyond a certain point, then it starts to create inflammation
Yeah.
because these fat vacuoles inside the cells irritate the cell, and that's what starts that inflammation process. So once you have inflammation, then it gets worse, and then you have cell death. When cell death happens, fibrosis starts. And when fibrosis continues for a long time, slowly, stage by stage, it reaches cirrhosis. So that's how fatty liver causes cirrhosis. So the answer to your question is, what is fatty liver? Is essentially any liver cell or a combination of liver cells being occupied by fat causing damage. Initially, it is just fatty liver. Then it causes steatohepatitis, which is when the inflammation comes in. Then, like I said, the fibrosis and cirrhosis.
So what could be the duration from fatty liver to, as you said,
Yeah, very
cirrhosis?
good question. I think it is not fixed in everyone because there are some things called risk factors, right? So if you are obese, if you're fat, but you don't have diabetes, you might take 8 years
Oh,
or 9 years or even 10 years to go from simple fatty liver to cirrhosis. But let's say you got high cholesterol levels and you got diabetes and you are fat, then the progression of the disease is faster and you might get to be cirrhotic even within 4 to 5 years.
okay.
So it's not the same for everyone. And the funny thing is, fatty liver, although 80% of fatty liver would be in fat people or diabetics, there is a 15 to 20% of fatty liver that seems to happen even in thin people, not so fat, what we call lean NASH or lean
So
steatohepatitis.
it's not about always obese people only.
80% it is, but a small proportion, especially us Indians, we have some genetic things that predispose us to having fatty liver,
Okay.
even though we are not fat. So whereas a Caucasian or even African Negroid might not have fatty liver unless they become very, very obese. You know about body mass index, right? So our body mass index is said to be, should be at around 23 to 24, up to about 25. And they need to have a BMI of 30, 35, 40 before they start having fatty liver. Whereas every day in South Asian Liver Institute, I see patients who have got fatty liver when their BMIs are still 24, 25, 26. So then we do some more testing in these people. We look for insulin resistance. We look for genetic patterns that can cause leanness.
But here in India, generally how the mentalities are, if something is common, they don't take care it as a severe.
You're very correct.
Yeah.
You're very correct. In fact, I'm always talking about that very point. It's not just India, it is just a human tendency that if everybody has got it, it's okay.
Yeah.
It's fine.
Yeah.
So, if you look at our country, the statistics are incredible. Our country has got approximately 350 million people with diabetes or pre-diabetes. Now, 350 million is the entire population of Europe, and that is just our diabetic population. So, if you look a little more closely into that group, let us say the people above the age of 40, nearly 20-30% of them will have fatty liver disease. So we are talking about 25, 30, 40 million people, or maybe even 100 million people with fatty liver disease. So obviously, then when we are sitting in a group of 10 people, 3 people have got fatty liver disease, and then each of them consoles the other. Oh, you also have fatty. I also have fatty. No problem. We'll be fine.
True, true.
But that is not true. Because if I look at, I've been in India for about 12 years now. And so in these 12 years, when I first came to India, we were the biggest center doing liver transplants in Hyderabad. And one of the commonest reasons for liver transplantation was probably viral hepatitis and alcoholic liver disease.
Okay.
And fatty liver would have been maybe 10%. Now, in the last, let us say, 3 to 5 years, it is now the number one cause of liver disease in India. And when I look at the last 2 years, 40% of the liver transplants that we do is for fatty liver disease. So if 40% of liver transplants in the country is for fatty liver disease, how is that not a serious illness?
People are not aware of it.
People are aware, but people are not aware of the fact that fatty liver disease can progress to fibrosis and cirrhosis. At least they don't seem to know. So about 2 years ago, South Asian Liver Institute became very unpopular on Facebook or social media because just for fun, one Diwali, we put an advertisement. We put a plate of jalebis in somebody's hand, and we said, you see jalebis, we see fatty liver. So, of course, some people said, oh, thank you for letting us know. But some people said, you're spoiling the joy of
True,
Diwali.
true. They say.
So it was quite funny, but it is true. The amount of sweet and carbohydrate that an average Indian consumes, I think, is much greater than what an European or a South American, for example, would consume. And at the same time, it's what we call a double whammy. So you got we eating more carbohydrate than you should, and at the same time, we got a genetic predisposition to truncal obesity. It's very common for us in India to see not so fat people with a belly. I'm a good example. I'm not so fat, but I got a belly. And this is very common for us Indians. And that suggests that truncal obesity or visceral fat is what is predisposing people towards fatty liver.
Okay.
So now you understand why we are the diabetic fatty liver capital of the world. There's no doubt. It's because we have that heavy carbohydrate load, and then we have this genetic predisposition, and then when you combine it, of course, you get disease.
So, what do you think are the most common causes for fatty liver?
I mean, it's very easy. There is no thinking. We know 40% of liver transplants. You're asking causes of fatty liver
Yeah.
or transplantation?
No, fatty liver.
Fatty liver. So, what we discussed already, it is that obesity is possibly the number one, even mild obesity, especially truncal obesity. Second would be the presence of diabetes, especially poorly controlled diabetes. Third would be hypercholesterolemia. And fourth would be that genetic predisposition to insulin resistance and certain other ligands.
Okay. So, when can a patient literally feel that I need a consultation? Because here they think it is okay. And can a fatty liver be reversible?
Reversible. Very, very, very nice question. So the first question is, when should they consult? So my personal feeling is everyone over the age of 40 should get an ultrasound abdomen, especially looking at their liver. So now India is a very heart-centric country. Everybody is frightened of heart attacks. But I don't know how many people know that nearly 250 or 300,000 people, that is 3 lakh people, die from liver disease also. And therefore, in their routine health checkups, they check out their heart, but they forget very important organs such as liver, kidneys, and other things. And I believe that a simple ultrasound, simple blood test like a liver function test will give you those answers so easily. And so I think the first question is, I think everybody should get themselves health tested. Why? It is not only because I'm a liver surgeon, am I feeling that. Can I ask you,
Yeah.
you're a doctor, in 2026, if your lung, let me not put you on the spot, if my lung doesn't
It's okay.
work, I can be put on the ventilator. If my heart doesn't work, there is a bypass machine, a heart-lung machine. If my kidney doesn't work, there is dialysis. There are people on dialysis for 10 years. But if your liver fails completely, do you know there is no machine called a liver dialysis?
No. Yeah, everybody knows, I guess. Yeah.
Exactly. No. Everybody knows what?
There is we cannot, without a liver transplant, they cannot live.
Yeah, I think you're a doctor, so you know. I don't think everybody knows. I think most people would think that, okay,
It's okay.
dialysis,
Yeah.
there is ventilation, so liver also, there must be something. But the truth is, dialysis for kidney started in the 1960s. Now, 60 years later, we still don't have a liver dialysis machine or a liver replacement machine. So that shows how complex the liver is. But that my point is that it also shows that it is the one organ that we cannot afford to upset.
And
So
that is, it's a vital organ for survival, but most denied also.
yes. So I think, so coming back to your question, when should somebody get checked? So I think the first is they should get a routine health checkup of their liver. So now when they do their ultrasounds or their liver function tests, if the liver function tests are abnormal, they must always get in touch with a doctor, a liver specialist, not just a normal doctor, and find out why is it abnormal. Because liver function test being abnormal suggests that quite a lot of disease has happened. But if it shows just grade 1 fatty liver disease, usually on ultrasounds it's graded into grade 1, 2 and 3. So if it is just grade 1 fatty liver disease, I think they don't need to come and see somebody like me. What they can do is just lose weight. If they are diabetic, control their sugars a little bit better, and then repeat a scan in 1 year.
Do they need any medications?
Not at that stage. So if they just have grade 1 fatty liver disease, normal liver function test, usually I don't think they need any medications. But medicine is complex, as you know, and therefore not everybody will fall into these exact rules. Some people are in between. So for example, what I would like everyone to know is that liver transplantation is done in people with a completely spoiled liver, right? Otherwise, why would we do a transplant?
True.
But even in that group, about 10 to 12% of them have got normal liver function tests. Isn't that funny? So people will say, what? You got normal liver function tests and you're doing a liver transplant? So that is the funny thing about the liver, in that nothing is too cut and dried. So better to get an expert to look at it if you're in any doubt. But on average, if you've got grade 1 fatty liver disease and you have taken steps to correct your obesity, your cholesterol, your sugar control, we can just do a second ultrasound, maybe in about 12 months' time. And again, if there is fatty liver or if there is worsening fatty liver, definitely you should see a specialist. Another thing that is interesting is, when you look at scans of the liver, there are two things. One is liver fat, which is steatosis or fatty liver. Then remember at the beginning of this talk, we talked about fibrosis. So second is fibrosis. So the liver that is fatty need not be fibrotic. And more we are finding out that some livers have got only grade 1 fatty liver disease, but grade 2 fibrosis. In a funny way, that's a very dangerous situation, because these people, without having had much fatty liver, are heading towards fibrosis, which is the first step towards cirrhosis, which is obviously the deciding factor for transplantation. So therefore, in our center in South Asian Liver Institute, what we do is we have now started to do fibro scans quite early. In the past, the only way to tell fibrosis was a liver biopsy, which is invasive. It's got some small risks. But now we have a fibro scan, which is similar to an ultrasound machine, which uses technology to measure fibrosis. A fibroscan is not perfect. It's not as good as a biopsy, but at least it allows us to get most of what we want.
So early detection of fibrosis, can it help?
Yes.
Can it help?
Yeah, of course. Because if you got grade 1 fatty liver disease, we will say, Manasa, don't worry, you'll be fine. Get exercising, eat better, you'll be okay. But once you start having fibrosis, I will say, no, let's have a look what's going on. You need to lose weight this month. We need to get your sugars right this month. And then we'll follow you up more closely. And all of this is really because of your second question, is liver disease or fatty liver disease reversible? And that is where, whilst it's a very precious organ, it also shows it's a very magnanimous or benevolent organ, because the liver will tell you today, Manasa, I'm not feeling well. And then it will wait for you to do something. Then next year it will tell you, Manasa, I'm feeling worse. It will give you 3 years, 5 years, 6 years, every time, slowly getting worse. It doesn't usually suddenly fail. There is something called acute liver failure, but that is very rare. The far more common thing would be what we call chronic liver disease. And chronic liver disease gives you years or at least months to warn you that things need to be changed. And then, as you rightly said, if we bring the corrective factors, if we bring weight loss, if we get the BMI down to 23, then the same fatty liver can reverse.
Okay.
So you might ask, if that is the case, why do you do a transplant? Why can't we reverse them?
Yeah.
Right?
Yeah, definitely. Everyone will have
See,
that.
I'm predicting your questions now. So the answer to that is liver disease. I told you, fatty liver, grade 1, grade 2, grade 3, fibrosis, grade 1, 5, cirrhosis. And the typical thing about cirrhosis is that it is irreversible. So the liver has got spoiled to the point that there is no normal cells anymore, and so there are no cells to reverse. There is no cells to bring health back. So it's like a plant. It starts to die, and then it dies, and then it dies, and finally it is completely dried. And even if you pour water, it cannot come back. It is exactly like that. So once you're into what we call decompensated, established cirrhosis, reversibility is not known. And that is why after that point, losing weight, controlling sugars makes no difference to the liver, and we have to do a liver transplant. And then after the transplant, we make sure that these risk factors don't come back.
But we see even in kids, right, very at young age, they undergo liver transplant. What are the causes? And can every child is eligible?
Yeah.
Who is eligible for liver
So the
transplant?
commonest cause of liver transplantation in children is biliary atresia. So biliary atresia is a congenital disease which is because of atresia, which is a tube, which should be a round tube, becomes a cord that doesn't allow bile to flow, and therefore that then causes cholestasis. That means bile is not flowing, and that causes liver damage. And that is why they end up with cirrhosis even aged 5 months.
Okay.
I don't know whether it's still the smallest, but about 10 years ago, I did the smallest ever liver transplant in a 4.5 kilo baby. So this child had biliary atresia, and we took half the liver or a quarter of the liver from the mother, and we gave it to this child. But children do very well after liver transplantation. It's fabulous. I'll show you a picture. They look as cute as a normal child. They grow as a normal child. Everything's fine.
But see, even elderly patients, okay, fine. But how about young patients, very young patients, as you said, the liver transplant span and all?
Yeah. Again,
Parents will
now
be
this is
more.
maybe one more reason I'm very happy that I chose liver transplantation, because the success of liver transplantation and the longevity, that means the number of years that somebody can survive after a liver transplant, is unprecedented. That means it is better than any other organ transplant. It's better than heart, it's better than lung, it's better than kidneys even. And there are people whom I worked for nearly 18 years in London. I've done about 400 transplants in London before I came back here. And many of them are, this is now 20 years ago, or maybe 15 years ago, and many of the children that I have transplanted when in London are now adults. We've got doctors who have post-transplant. We've got engineers who have post-transplant. We have a lawyer, the very, very special young girl who was the youngest ever baby to be transplanted. She was transplanted when she was 5 days old in King's College, London, from hemochromatosis. That's again a congenital disease. And that baby is now a very good-looking lawyer with blonde hair in London. I think in Ireland. I'm not sure. She's originally from Ireland, I think. Anyway.
They do contact you?
Not really. She was done in King's by my teachers, so I didn't do that one.
So, who are the ideal patients for liver transplant?
So That's a funny question because we don't want ideal patients, right? We only do this transplants because they have no other choice. But I think what you're asking is who should have a liver transplant, right? So I think there are many criteria that we use. In fact, in South Asian Liver Institute, we are now doing a trial and a clinical study on how to assess whether patients need a transplant. But the classic score that we use in medicine for assessing is something called a MELD score. So we measure bilirubin, we measure albumin, we measure many other things, and then we come up with something called a MELD score. Incidentally, MELD score is used all over the world, and it was devised by an Indian. We should all be proud. A guy called Dr. Patrick Kamath. I know him, and he worked in the Mayo Clinic when he devised this MELD score. So, MELD score goes from 7 to about 40, I think, and when the score goes about 13 or 14, usually they need a transplant.
Okay.
When I was in London, what we would do is our MELD score cutoff was 14. Beyond that, we would list the patients for transplant on the waiting list. In India, also we use MELD score, but everywhere in the world, it is not just MELD score. Sometimes you have liver cancers, and we do transplants for liver cancers, and they don't have to have a high MELD score. Sometimes they have other decompensating factors. For example, I told you 10% of patients have got normal liver function test when we do a transplant. So in such patients, looking at the MELD score alone will not give you their disease severity. Sometimes, liver patients can have ascites, water in the tummy. They can have hepatic encephalopathy, which is brain coma because of high ammonia levels. They can have renal failure because of liver failure. So many of these diseases are also good indications for liver transplantation. So I think it is too complex a question to answer in a podcast, but I think anybody who has got his or her life spoiled by liver disease, definitely if they've had even one admission to a hospital because of liver disease, must see a liver specialist and check out how bad the liver is, what do they need to do about it, etc.
What do you suggest? Yearly test or scan are enough, or how?
So I think if you are a healthy man or woman, I think even once in 3 years is enough for example, if you do a health checkup and everything is normal, liver function is normal, ultrasound is normal, you're feeling well, I don't think you need to do it every year. You can just do it once in 3 years. But if you're known to have developed something like fatty liver disease or something else, or if you're known, for example, an alcoholic knows that he's drinking too much. So if you are drinking too much, or if you know you are a poorly controlled diabetic, then it is important to get checked more often. Alcohol is a very sensitive topic when it comes to liver disease. So there is something I want everybody to know about liver disease. Unfortunately, especially in our country, but like I said, I worked for 20 years in London, and even in the UK, somebody who's got liver disease is assumed to be an alcoholic often. And that, unfortunately, doesn't allow many people with non-alcoholic disease to come to the hospital. Oh, if I go to see a liver specialist, they'll think I'm an alcoholic. So I want you to understand that maybe 35 or 30% of our patients are actually alcoholics. So people who abuse alcohol or drink far more than they should. The remaining 65% are normal, good people.
So tell me about what are the types of liver transplant and donors, deceased donor and a live donor.
Yeah, very nice. So I think you have said it. There is, broadly speaking, two type of transplants. One is where we take a liver from a relative,
Hmm.
a son, a wife, sometimes a father, sometimes an aunt, sometimes a cousin, and we take part of their normal liver and we put it into the body of the patient who has got liver failure. That is called a living donor liver transplant. But when transplantation or liver transplantation first started, the commonest way of transplanting was cadaver transplant or dead donor liver transplant, where we take the liver of patients who have died of brain injury, usually called brain stem death, but their livers are normal. A typical example would be a road traffic accident. A young man who has a road traffic accident, he has a head injury, his brain is dead. But because of the ventilators, his heart is working. And because his heart is working, blood is being pumped. So the liver is still healthy. So such livers, we go in and we take it out, called a retrieval.
Okay.
And then that liver we put into the person who needs a liver transplant. So that's called a cadaver liver transplant. So approximately 95% of transplants in Europe would be cadaver transplants and about 5% living donor transplants. And in India, 70% of transplants are living donor and only about 25 to 30% is cadaver transplants.
Why why is that difference?
Why is that opposite? It's because of a combination of factors. It's because Europe is a well established, developed organ donation program, whereas we are a fairly new country in terms of organ transplantation. Secondly, I think we Indians have a lot of superstitions, and some people would say, oh, what if he needs his liver in the afterlife? Oh, I'm not sure this is good for him in his way to heaven, or this might affect him in his next life. There are so many
So
such
cultural and religious things are also affecting in the
affecting organ donation
donation.
rates. So our organ donation rates is possibly one of the worst in the world. And that is why, unfortunately, healthy people have to come forward and donate their livers to save their loved ones, which is quite sad for me. And therefore, every year in South Asian Liver Institute on Organ Donation Day, we have big organ donation drives. Dr. Swarnalatha, Dr. Bhushan, who is now the head of Jivandan, are also very strong campaigners for.
So you are doing awareness
Yes, we are
programs also.
Yes. So I told you, I started the liver transplant program in NIMS, and NIMS is also the nodal center for Jivandan. So NIMS has got Professor Birappa, who's the director, is a GI surgeon himself, a very good friend of mine. He and NIMS and all these people have been very instrumental in Telangana becoming one of the best states for organ donation in the country today.
Okay,
So
happy
we
to
can be proud.
Yeah. So, what are the risks during liver transplantations and after afterlife of the liver transplant?
Sure. Yes, liver transplant is not a small operation, as you know. But even you being a doctor, I'm not sure you know exactly how difficult it is.
Definitely, yeah.
I'll give you an example. Even most average people would think a cardiac bypass surgery is a very big, one of the biggest operations that man can have. So a bypass operation needs about 4 hours, maybe one surgeon and an assistant, maybe about 35 sutures, the stitching stuff. In comparison, a living donor liver transplant takes about 13 hours, about 40 40 people, uses about 250, 260 sutures. So now you understand about 6, 7 surgeons, 3 or 4 anesthetists. Now you understand, even when you compare liver transplantation to what people think is a big operation like a bypass, cardiac bypass, heart surgery, it is 5, 6, maybe even 10 times more complex.
True.
Therefore, such a complex operation in such a sick patient cannot be done without complications. And we have a death rate because of these complications. And the common complications nowadays would be infections, number 1.
Okay.
And number 2 may be rejection. Number 3 will be technical complications like hepatic artery thrombosis, portal vein thrombosis, bile leak, things like that, which is because of problems with the joints that we make. So, so on average, if you look at, I have now done about maybe 400 transplants in India. Our average success rate, if you like, would be about 90 to 93%. So that is about 7 to 10% average death rate in chronic liver disease. It is higher in acute liver failure. But the great or the good news about liver transplantation is if you do well in the first 3 to 4 weeks, usually they do very well afterwards. And like I said, I have fruit sellers who have had a transplant.
Okay.
Obviously, I have had children in school. I have had cement workers. Day before yesterday at South Asian Liver Institute, we had somebody who is now 2 years post-transplant, and we did an online consultation like this with him. He was at his workplace, and I looked at him, and he had that yellow engineer's hat covered in cement. He is a chemical engineer in Ultratech cement factories. And he is underneath the lorry looking at this, and he had a transplant 2 years ago. Most people think liver transplant, after that you have to stay at home. No, they lead a normal life. There's another very special patient of mine. She was a medical student, a very pretty girl who was a medical student in Gujarat when she had acute liver failure. She was airlifted to us here in Hyderabad. We did her liver transplant. Her brother donated the liver. And that is now 9 years ago. She has finished MBBS. Then she did her MD gynecology. She became a gynecologist every day doing obstetrics and gynecology, cesarean sections, etc. 1.5 years ago, she delivered her first baby herself. And about 6 months ago, maybe 4 months ago, came to South Asian with her little baby. And so 9 years later, there is no change to her liver. It's as good as the liver we put in 9 years ago. So that means there is literally no limit to the length that she can live or this liver can live. I'll give you another funny statistic.
Yeah, please.
There are people whom I transplanted in London who were only in their 20s when we did the transplant. And we took the liver from somebody who's 65, 68. And those 20-year-olds are still living now 20 years later. So their livers is 80 or 85 years old.
True. Interesting.
Isn't that very interesting?
Very
and when
interesting.
this boy or girl is 80 years old, that liver will be 130 years old.
True.
Isn't that
Yeah,
incredible?
Yeah.
So liver transplantation is still very new, and therefore we haven't seen these 120-year-old livers yet. But in the next 20 years, we will find out. But it is quite known that the liver doesn't age. It does age, but it doesn't age as much as
Other organs. So please tell me about how do you manage your personal life also? Like I heard just now as before the podcast, You just told me about you manage schools, even colleges, and again there is a South Asian liver transplant institute also. How do you manage all these things?
I sleep very little. So I think my, if you like, baby is South Asian Liver Institute. It's something that I created. South Asian Liver Institute has got 4 transplant centers, one in Mumbai, Nagpur, Hyderabad, and Vijayawada. In addition to that, we run 11 what we call outreach clinics. So we have clinics in Agartala, Vizag, Calcutta, right down to somewhere like Rayalaseema. So we have these 11 outreach clinics, and then we have these 4 transplants. So this is really what I created and my specialty and my passion. The schools and colleges that you talk about is a educational society that is run by me also, but it was started by my father. My father's name is Jacob Cherian. He's a very famous cardiac surgeon. He's a Padma Bhushan. And he started a hospital near Coimbatore, and he ran many of these hospitals. And then in order to lift that district, because it's a rural place, he started schools, and then he started colleges. And so there are eight institutions under that education society that I now run. We have about 6,000 students there.
Great.
And it is spread over.
What keeps you motivated and passionate to do all these things? Because even there might be young people who wanted to know.
So liver side, I enjoy operating.
I can see that actually.
So I find operating almost like an art. Almost, it is like an artist drawing a picture. And if I can join the artery in a perfect way, so it looks almost like it looked before I did that join, it's like an artist having done a great job.
Love the way you explain it.
So I enjoy. It is one of the most difficult operations. So if you can do it well, it gives you a sense of satisfaction. Second reason why it is so satisfying is what I told you before. Post-transplant patients are absolutely fantastic. We have liver transplant Olympics where patients are competing in normal sports. So the quality of life of the patient who was dying going back is almost incredible. And another incredible thing is, I don't know whether you eat meat or not, but if you go to a meat shop and you see a dead liver or a dead heart, can you imagine that dead heart or liver coming back to life? That's what we do every day. And how can you be bored with it?
True.
So we see these livers that is not working, no blood, and then blood comes in, it starts working, it starts producing bile. And believe me, it is impossible to be bored with liver transplantation. So that is liver. These institutions in Tamil Nadu are actually, it's called Christian Education Society. And so that's been going for 60 years. And we have the poorest of the poor children coming there.
Okay.
Our engineering college students will come to class without slippers, forget shoes. So in the 4 years, they have to compete with students from high-tech colleges like CBIT and IIT Hyderabad when they didn't even know English in their first year. They didn't know how to put a belt on. They have never had a belt. How would they know how to put it on? So this group of institutions has changed nearly 3 districts in Tamil Nadu. And again, I feel I cannot allow it to not do well. So that sense of duty sort of makes me go on with that. So even today, every day between 7 and 10, I have Zoom meetings with my
you told me.
education, what do you call that, leaders of the education. So the principal of the engineering college, etc., etc. And so that part of the morning is given to those, and then the liver takes over the rest of the day.
both the ways you're giving life, to the you're molding their careers, and other way for the patients too.
So it's quite good fun because you see these boys and girls, they do well. Um, Somebody like that from an absolute village who did not know even English is today the Minister of Food and Agriculture in Tamil Nadu.
Really?
Our students.
Okay.
One of our another students is the head of Fujinon. Fujinon is a very progressive, high-tech Japanese company, and he's the head of Fujinon as an engineer. So it's very satisfying and fun to watch these things happen. In 3 weeks' time, we are starting a new school called Christian International School. And so hopefully it'll do well.
So it is also in Coimbatore?
Yeah, they're all about 100 kilometers from Coimbatore.
Okay. So thank you so much, sir. Thank you for joining us today, and thank you for your valuable insights.
I don't know how valuable they are, but it was a pleasure to be here.
I too, I enjoyed it. Thank you so
Good.
much.
Take care.